Well, you hear us talk a lot about all the different kinds of injections and treatments there are out there. Well, sometimes we just have to take a step back and understand all of the options there are when it comes to our face. Dr. Sidney Starkman, he is a board-certified plastic surgeon, and he's here to break it down a little bit, well, as much as we can in 3.5 minutes, right?
Right.
First of all, welcome to Sonoran Living, Dr. Starkman.
Thank you, Terry. It's great to be here.
I am excited to have you here. I want to talk a little bit about the treatment options out there. It can be a bit confusing, which is why you insist on this one-on-one consultation. What do we learn during that consultation, or what do you learn about us?
That's a great question. And you know, to start with that, you asked me about what I learn, what they learn, and it really starts with me being the listener. Because every patient is different. Every patient comes in with different anatomy, different goals, different stages of their life, different desires, and the important thing is me starting off by asking them what is the thing that bothers them as they're aging. There's something, when we're talking about a cosmetic consultation, we're looking for what is the thing that makes them feel like they're tired, and there's different changes that go on. So it's important to recognize whether it's skin aging, gravity, or also there's volume loss. As we get older, we're losing fat volume, bone volume in our face, and usually coming up with a combination of different things to really suit their needs and going over in detail the plan with each person.
I want to take a look at, this is a woman, one of your clients, and tell me what you did to her, because she looks remarkably younger, I'll just say.
Well, this is one of my patients, a beautiful, beautiful woman, and one of the nicest people that you'll meet. And she came in and she very happy, confident in herself, but you know, just really felt like she was getting a little bit older. She still felt like she did when she was in her 20s, 30s, but just didn't like how she felt like she was looking a little bit more tired. Things were falling down.
So what did you do?
So she had a mini facelift, something that lifted up right around the jawline and the face. Here, nothing was done to really address the skin, but you can see she still looks like herself, but just about 10 to 15 years younger.
But that's what we all want. Oh, you look amazing, but we don't know why. Okay, the eyes have it. Tell me about what you did here.
This is another patient, a little bit younger, and people ask about the right time to have surgery, but it mostly comes down to genetics too. So she has very heavy upper lids. People would always talk to her about why she felt like why she looked like she was tired or stressed, and really she wasn't. It just was the heavy look of her upper eyelids. So all she had was a minimal procedure, upper eyelid lift. And you can see what that does is opens her eyes, makes her look more youthful over there on the after photograph.
And yes, because the eyes have it. When you look in somebody's eyes, you know, there are the windows, right? So,
Absolutely.
And you do all this in office.
Yes, so what we have here in our office is we have an in-office procedure area, full surgery center, where we can do all of our procedures under IV sedation with no general anesthesia for specialized care.
And here's what I also love about you, besides your awesome pink socks, by the way, the fact that you are giving back. Tell me about your work, your humanitarian work.
Well, you know, I think it's important for anyone in our community to give back to the community and internationally. So, in addition to doing work with the communities in Arizona and also back where we were before, we do like to do international work, traveling around to China, Belize, Honduras, and do things for reconstructive facial plastic surgery.
Tell me what you did to this little boy.
This is a little boy that we saw in Belize last year, and he came in with a cleft lip, a little division in between his upper lip, and came in with his family, and he was one of the few that I treated for a cleft lip repair. And I was able to see him again at a trip we did later that year to see how he was doing, and at that point also repair his palate too. And just a great kid and great family.
I'm so happy for him. Well, thank you for all that you do, and thank you for coming on the show today. I'm excited eventually to head out to your new office location, but guess what? You can do the same thing, because Dr. Starkman is having an open house event, and you are invited. It's happening on Thursday, November 7th from 5:30 until 7:30. He's going to do live demos, talks on all kinds of treatment options, food and drinks, and get this, over $10,000 in giveaways. And for the first 20 viewers who actually call and RSVP, you're going to receive credit for 10 units of Botox. That's a nice thank you, right? All right, let me tell you where he is located. Book your appointment also for a free consultation at Starkman Facial Plastic and Laser Surgery. He's located at 8560 East Shea Boulevard. That's Suite 110 in Scottsdale. 480-590 2697 is the phone number. Learn more, visit the website scottsdalefacialplastics.com.